Hello, my name is Mary Fliss. I am the Deputy for Clinical Strategy and Operations in the Clinical Division of the Washington State Healthcare Authority. Thank you for joining us today as we discuss eliminating hepatitis C in the state of Washington. Today's panel includes Sue Birch, who is the Director of the Washington State Healthcare Authority, Dr. Kathy Lofy, who is the state's health officer as well as Chief Science Officer working in the Department of Health, and Dr. Judy Zerzan, who is the Chief Medical Officer in the Healthcare Authority. In today's presentation, we're going to get a brief overview of the hepatitis C virus in Washington State, a description of Governor Inslee's 2018 directive to us, an overview of the Healthcare Authority's work related to the directive, as well as an overview of the Department of Health's work related to the directive, what primary care providers can do, as well as what's coming in this webinar series.
This is Kathy Lofy from the Department of Health, and I'm going to start the presentation by giving you a brief overview of hepatitis C in Washington State. I'm going to start by talking a little bit about the natural history of hepatitis C. The blue boxes on the right of the slide show the natural history of hepatitis C after someone is infected. And you can first see that about 20 to 30% of people have symptoms during their initial infection with hepatitis C. These symptoms are often quite mild, and so most people really don't even know that they are becoming infected with hepatitis C at the time. Most people who acquire hepatitis C will then develop a chronic infection, which means that they will live with hepatitis C for the rest of their lives unless they receive curative treatment. As you can see, then of that group, about 10 to 20% will go on to develop cirrhosis over the next 20 years. And of them, 1 to 4% will develop hepatocellular carcinoma. While hepatitis C is primarily considered a disease of the liver, it also causes problems outside of the liver as well. And current studies show that up to 74% of people living with hepatitis C have symptoms outside of the liver. So hepatitis C is responsible for a large portion of deaths among all the infectious diseases that public health tracks. This graph shows that around the year 2011 to 2012, the number of deaths from hepatitis C started to exceed deaths from all of our other nationally notifiable conditions. Each year here in Washington, somewhere around 500 to 650 people die of illnesses that are related to hepatitis C. And since 2000, more than 15,000 people in Washington have died of hepatitis C. Hepatitis C is the most common bloodborne infection in the United States and has a great toll on our society. The disease now is seen in all age groups, but we're really seeing a rising morbidity and mortality in our aging baby boomer cohort, which is the folks that were born between 1945 through 1965, because many people in this cohort have now been infected with hepatitis C for several decades. Hepatitis C is the leading cause of liver cancer and the leading indication for liver transplant in the United States. Hospitalization costs related to hepatitis C here in Washington were around $114 million from 2010 through 2014. So as you can see, this disease does take a great toll on our state. While we currently have no vaccines to prevent hepatitis C, the good news is that there are new medications that can cure hepatitis C infection in more than 90% of patients in 8 to 12 weeks with very few side effects. So an estimated 59,100 people were living with hepatitis C in Washington at the beginning of 2018. In 2017 and 2018, there were about 500 deaths attributed to hepatitis C here in Washington state. If you look over at the table to the right, one concerning trend we're seeing is an increase in acute hepatitis C cases in Washington, and this suggests that our epidemic is growing. We're also seeing an increase in newly diagnosed chronic infections. So these trends could be a combination of different factors, including an increase in injection drug use, an increase in screening and testing, an increase in reporting, and new screening recommendations, and just an increased general awareness about hepatitis C in our state. While we don't have exposure data for many of our chronic hepatitis C cases, we do know that when we are able to talk with individuals, they often report that injection drug use is their most common risk factor. So Dr. Jonathan Mermin from the CDC characterized hepatitis C as a deadly, common, and often invisible result of America's opiate crisis. So most of you know that Washington and the United States has been experiencing an opioid overdose crisis over the past decade. And Dr. Mermin really nicely kind of pointed out how hepatitis C has really been an invisible aspect of the opiate crisis. It's not a disease that you hear about very often. But he also optimistically says that, you know, if we can test people who inject drugs for hepatitis C, we can treat those who are positive, and we can prevent new infections, we can really have a big impact on the nation's devastating opiate crisis and save lives.
So, Kathy, for that great introduction. I'm Sue Birch. I'm the Director of Washington State's Healthcare Authority, and I want to share information today about the Governor's Directive 18-13. Next slide, please. So we are so fortunate here in Washington to have a governor who is invested in public health and the well-being of all our Washingtonians. Governor Inslee issued Directive 18-13 to eliminate hepatitis C in Washington state by 2030. Now, what that did was it directed both the Healthcare Authority and the Department of Health to jointly develop strategies to eliminate hepatitis C from Washington state. Next slide. The main elements of Governor Inslee's directive included for the Healthcare Authority, taking a leadership role in developing an innovative procurement strategy to reduce costs of drugs for all state-covered lives and finance public health efforts. This strategy was groundbreaking in the country, and we were amongst the first states to really get going on making this happen. Judy's going to talk later about that comprehensive procurement strategy. Now, Department of Health is our partner, also had to develop a comprehensive public health outreach strategy, which Kathy's going to come back and talk about later in this presentation as well.
Hello, I'm Dr. Judy Zerzan. I'm the Healthcare Authority's Chief Medical Officer, and I'm going to talk about next our purchasing strategy for hepatitis C drugs. We started this effort with a request for proposals that was issued in January of 2019. We requested from the hepatitis C drug manufacturers discounted drug costs for all state-covered lives, as well as for some support with outreach services. This RFP ended with a partnership with AbbVie, and we have two contracts that were effective July 1st of 2019. One of these contracts is for Medicaid, which is for both a lower price and for patient outreach services. And the second contract is for our non-Medicaid business, public employees, school employees, and retirees to get the same net costs for all non-Medicaid programs. Our purchasing strategy for Medicaid represents a modified subscription model. You've probably heard that we have a Netflix model, and it isn't quite that, but it is a subscription model similar to that. For Medicaid, we get a guaranteed net unit price per pill, and after a treatment goal is met or a number of pills have been dispensed overall in the Medicaid program, our drug cost becomes negligible, something like a penny a pill after we reach that threshold. We also have outreach support services that are done in collaboration with the Hep C-free Washington work that you've heard about elsewhere in this webinar. Our non-Medicaid contract includes a traditional rebate for our public and school employees and injured workers covered by labor and industry. There's also an upfront discount and distribution for the Department of Corrections and for state hospitals. There's also an option to pursue 340B pricing for the Department of Corrections, which we are currently exploring. The outreach support that we are getting from AbbVie as a part of this contract is encouraging the public to get screened and helping patients get connected to care. One focus area that we've looked at with them are for people who inject drugs who have unique support needs, and hepatitis C is much more common there. In 2019 and early 2020, we had events scheduled and we deployed an Elimination awareness bus that was able to go to a couple of events and have people get on the bus, get counseling about hepatitis C, and get a rapid test and get connected to care. AbbVie, we also have nursing and social support work. We also have nursing and social work support through the MCOs, through AbbVie, and through others. We've been working with the Department of Health and counties with syringe services programs, opioid treatment programs, and medication-assisted therapy providers. And we've been working on social and mass media efforts. AbbVie has also helped us with some data solutions to support the development of care cascades and hotspotting. This helps us figure out where is it likely that there are people with undiagnosed hepatitis C. Where is it likely that there are people with diagnosed hepatitis C that haven't gotten treatment? And where are the locations where providers are very effectively screening people and treating people and getting them to a cure? And how can we replicate what those clinics and providers are doing? Finally, there's provider education and support, partnering with, educating, supporting prescribers and other caregivers. So our Medicaid pharmacy policy that's been in place since July of 2019 is that any licensed prescriber is allowed to screen for hepatitis C and treat them. Prior authorization is not required for Mavyret, the drug that is manufactured by AbbVie. We do not have any sobriety requirements, and evidence of fibrosis is not required. Since Mavyret treats all stages of fibrosis, there isn't a need to figure out where a patient is before starting treatment. And the wait time to validate that this is a chronic condition is not required. So as soon as a patient has a positive test for hepatitis C, you can start treating them.
This is Kathy Lofy again from the Department of Health, and now I'm going to talk to you about some work that's underway at the Department of Health to address hepatitis C. So back in 2018, DOH convened multiple hepatitis C experts and stakeholders and developed a plan to eliminate hepatitis C here in Washington state. This elimination plan was released in July of 2019 and is comprised of 15 goals and 90 different recommendations. So the Hepatitis C Free Initiative is our state initiative to eliminate hepatitis C. It's a collective impact seeking a multi-sector response to the public health threat to hepatitis C. So the concept is that we need to bring multiple stakeholders together from multiple different sectors if we really want to have an impact in our if we can be successful in working together to eliminate hepatitis C in Washington State by the year 2030. Some of the values that this initiative has embraced include easy access of testing and treatment for everyone, upholding the dignity of each person, clear communication, health equity, and innovative solutions. So the initiative's goal is to eliminate hepatitis C by the year 2030. And by hepatitis C elimination, we mean reaching a state where hepatitis C is no longer a public health threat and where those few people who become infected with hepatitis C learn their status quickly and assess curative treatment and access curative treatment without delay, preventing the spread of the virus. So while we don't think it's possible to completely eliminate every single infection of hepatitis C from our state, what we're really aiming at is really a state where few people are infected and those who are infected can very quickly learn their status and get treatment. So we believe that we in Washington are really well positioned to reach this goal for several different reasons. First of all, we have good access to syringe service programs here in our state. Washington State was one of the first states in the nation to establish syringe service programs, and we have a fairly robust network of syringe service programs across our state. And this is really important to make sure that people have access to clean syringes and in order to help interrupt the transmission of hepatitis C. We also have had a large increase in access to medications for opiate use disorder. This is really important to get people with substance use disorder and opiate use disorder treatment to help them manage their chronic condition. We have committed medical providers willing to treat and cure hepatitis C, and we're very fortunate to have some of the leading experts, national experts in hepatitis C right here in our academic institutions. There are people here in Washington who are studying hepatitis C interventions and really doing training throughout the state to build capacity for providers, all kinds of providers across the state to be able to treat people for hepatitis C with the new drugs that are available. We have also recently expanded Medicaid here in our state and initiated new Medicaid policies that make it possible to treat most beneficiaries living with hepatitis C. So we've tried to break through some of those policy and those funding issues that sometimes provide barriers to getting people treatment. The AIDS Drug Assistance Program, supported by the Department of Health, supports treatment for people with supports hepatitis C treatment in people who have both HIV and hepatitis C. And then we're also in the process of improving our hepatitis C surveillance and data collection efforts. And we're receiving some support from the CDC for some of these efforts currently. So the elimination of hepatitis C here in Washington by 2030 is a very ambitious goal, and we know that we will have challenges. And this slide outlines what some of those challenges and barriers may be. First of all, we are experiencing an increase in homelessness, which may make it more difficult to treat individuals with hepatitis C. I also showed you earlier, we're seeing an increase in the incidence of acute hepatitis C, and that increase is occurring particularly among young people who inject drugs. So we know that the epidemic is growing in that group of individuals. And we're also seeing racial disparities in hepatitis C cases that are being reported. And these will all be challenges for us to overcome during this ambitious effort. We also know that while there are many health primary care providers that are interested in treating people for hepatitis C, a lot of them are still not ready and need more training to be able to feel confident treating people with hepatitis C in their practices. And then lastly, unfortunately, there's been very limited federal investments in viral hepatitis C surveillance, prevention, testing, and treatment interventions. over the past decades. So we really need to think about how we may be able to identify some funding that can help to support some of the public health interventions that need to occur.
Hello, this is Judy Zerzan again, and I'm going to talk about the role of primary care providers in this next section. So what we need from you, action. This is a huge opportunity to rid our state of hepatitis C. This is a winnable battle, and all providers licensed to treat HCV should screen and treat our target population. Treating hepatitis C is really easier than ever these days, and primary care providers have a role to play in this screening and treatment cascade. So primary care providers, we'd like you to screen appropriately for hepatitis C in your practice. Ensure that a positive hepatitis C antibody is followed up with RNA testing to figure out whether this is a current versus a past infection. And then make hepatitis C treatment available and part of the standard of care within your healthcare practice. We'd really like to encourage you, if you haven't already, to obtain a buprenorphine waiver so that you can provide comprehensive services for an at-risk population. People with opiate use disorder are more likely to have hepatitis C, and you can treat both of these at the same time. Collaborate with nurses and other members of your clinical team to have them serve as case finders and referrers and follow-ups, and make sure your clinical team is practicing at the top of their license. Screening for hepatitis C has changed in the last year. The CDC now recommends that everyone over 18 years of age get at least one hepatitis C test. For people who are more at risk, the people with conditions on these lists, they may need more frequent hepatitis C testing and are particularly important to target for testing and get them connected to care. We have a number of resources to help you learn how to treat hepatitis C. We have a provider cheat sheet that is online at this website that's listed there that provides in 2 pages what you need to do. And it's much simpler than ever before with using Mavorite and the restrictions that we've ended that were previously on this hepatitis C drug. Hepatitis C Online is another access point. There's a free self-study course, and there's also a Project ECHO on hepatitis C. Both of these are supported by the University of Washington and can help you. ECHO can particularly help you if there are difficult patients and you want to learn more. The American Association for the Study of Liver Diseases and the Infectious Disease Society of America have guidelines. They are posted here. They're a bit longer, but give a little more detail. University of Washington's Project ECHO program, I want to talk a little bit more about because I think this is a really great resource if you have time and interest. The sessions are held each Tuesday from noon to 1:30 p.m. and there's a contact email on the slide. And then finally, AbbVie is doing provider outreach and education. They will be providing webinars and educational sessions. They have some unbranded materials if you'd like to post information about hepatitis C in your office. And they also can provide a one-on-one consultation with a clinician to help answer your questions. We're excited about this effort, and we hope that you take action based on this webinar. There will be more webinars coming, and I think this is a really great opportunity to eliminate hepatitis C in our state.
So I want to thank you all today for joining us today. And here's a preview of what's coming next in this webinar series. So in the next webinar, Dr. John Scott from the Hepatitis and Liver Clinic at Harborview will provide an in-depth look into the disease state and treatment. In addition, more information about registration for that webinar will be coming out in the next couple of weeks. Thank you all for your interest in our hepatitis C elimination work here in Washington State.
Again, thank you for joining us. We hope that you enjoyed this presentation, learned something from it, and will help us eliminate hepatitis C within our state. Thank you.